So welcome everyone, and thank you for joining us today for our Q&A discussing a little bit about face coverings, especially what that means for businesses in the Sudbury East. I'll just introduce the Chamber a little bit. We're just a non-for-profit organization, and we help support businesses in the areas of French River, St. Charles, Marks Day Warren, Killarney, and Doki's First Nation. Our primary focus is really to help businesses and communities achieve excellence through learning, workshops, advocacy, and more. Today we have with us Jason Chenal, who's our president of the Sudbury Chamber of Commerce. He's also a local pharmacist he owns Alba and Noelville Pharmacy. We have Burgess Hawkins and Adam Ranger, both health inspectors with the Health Protection Division at the Public Health and Sudbury Districts, and myself, Véronique Demers, Business Development Officer for the Sudbury Chamber of Commerce. And we're just going to move to opening remarks with Jason.
Thanks, Véronique, and thanks Burgess and Adam for joining in. The public health office has been excellent to sort of field our questions and sort of coordinate a good conversation. COVID is an unprecedented time where we've business operators have come to make speedy decisions where speed sort of trumped perfection. And about a month or so ago, the Sudbury District Public Health Unit put out some policy on facial coverings and hand sanitizer, social distancing, and this type of stuff for customers as part of Phase 3 in Ontario. And because we sort of had to adapt to some of those, we've gotten some feedback along the way from our chamber members, our business owners, operators, and we wanted to share some of the topics that have come up in conversation and discuss some of the gray areas so that we can help business operators navigate within them. So we're empathetic to the smaller resources that SMEs or small medium enterprises have, and we hope that this sort of conversation will shed a little bit of light on what we've done in Sudbury East, what some of the business operators have come up with so far. Some of these conversations have come from different industry, and for sure they're not all inclusive. But what we would welcome, email and phone call follow up afterwards through the chamber to start sharing different ideas as well. So I think the plan is to sort of have Véronique open up a few topics that we've picked based on some of the feedback and challenges that our members are getting. Have Burgess and Adam sort of take us through a little bit more detail, maybe elaborate on the different topics, and then I'll try to share some specific examples of what some businesses might be doing, and then we'll sort of we'll send that out to members, and we'll take feedback where it needs to go. I think so. Véronique, maybe we can just start with the first one.
One of the concerns that was brought up by local businesses is appropriate customer management for medical and religious exemptions. So what are the guidelines for those types of customers that express that they cannot wear face coverings due to medical or religious exceptions?
The advice from public health for that has been that if the person is telling you they can't wear a mask due to medical or religious reasons, is to basically accept that at face value. We're not requesting people have to disclose their medical backgrounds, their religious backgrounds. If the person tells you that they have a medical reason that they can't wear a mask, then that is considered acceptable. Now, what to do once the person tells you that is the decision of the business. Some businesses are saying, okay, that's fine, please keep distances, etc. Others are saying they, for protection for their staff, they prefer if people who cannot wear a mask do not enter. Both are basically acceptable. It is your personal policy on how you want to run this. One thing to note, however, although I haven't seen it come up in any documentation, there has been some questions around whether or not a person who has a medical reason to not be able to wear a mask, if they are not allowed into a establishment, if there is a discrimination, a viable discrimination complaint at that point. I don't have an answer on that. That's something that a lawyer would have to answer, but it's just something to flag for your members.
Mm-hmm. In terms of so medical exemptions, the idea is that if we're sort of operating on a good faith principle. So what I've we're always looking at what one-liner can we put in for our staff to sort of ensure that the customer is getting the benefit of the services and the product that the business has, but at the same time, not turning away customers, especially for SMEs, some who have had to close their business for a period of time, others maybe had to see a reduction in business. Some SMEs are starving for that customer, and we're trying to balance, safety for staff, safety for public, flattening the curve, all of these key points, with all the business economic side of things. So I think, the thing that the one-liner that I've started practicing is someone comes in without a facial covering, we certainly have the sign on the door, and the idea is that the staff is reminding or prompting, but also not creating excessive conflict or unnecessary conflict. So are you able to wear a facial covering, or are you able to wear a mask? And that sort of open-ended question might allow the staff member to realize that, okay, they've got a medical exemption. So are you able to wear a facial covering? We certainly have a number of businesses that sell masks and different disposable or cloth facial coverings prominently. So that's sort of our passive way of saying, here's the masks. They're here for purchase if you need them. Some of them are giving them away if they were able to get enough. We mentioned the sign on the door, so that I should say that the chamber, the Sudbury East Chamber, has a sign that they've developed, and this was to show unity amongst the businesses in our area, to show that, look, we're all in this together, and if we do this together, then we should get through this with a lot less stress, a lot less conflict. So I suppose that's probably been the nicest balance that I've seen happening. I haven't had much experience with the religious exemptions part. I wonder if you guys could sort of give maybe some specific examples, if there are any, about medical and religious exemptions. So I suppose we're not asking for these things, but what types of things might we be thinking about when we say someone has a medical or religious exemption?
Well, like I said, we're not requesting that you ask what those religious the medical exemptions are, or religious for that matter. Like there are a number. Somebody has COPD. There are people who have severe anxiety with their face covered. There are numerous items. Some people are willing to say, yes, I've got this issue. Some they want to be private about. What our suggestion is just to take them at face value on, I cannot wear this mask due to medical reasons, due to religious reasons. Now, personally, I am unaware of which religions would prohibit the use of a mask, but that doesn't say that there aren't some, because I will be first to admit I do not know the dictates of all the religions around. So the idea is that you're taking the person on face value, the person is being honest that they cannot wear a mask, and going from there.
Very good. So it's, you know, we're not probing into, you know, personal medical or religious history, but we're operating on a good faith, a trust, be kind to each other, I think was the sort of direction from Dr. Sutcliffe to, you know, be kind to each other, be safe, be reasonable. Here's the general concept, facial coverings, except if you understand that you may have a, you know, a medical or religious reason for not being able to do that. Maybe you guys could just specifically explain where kids fit into this part. There's been some questions through our chamber about, you know, what age groups or what, you know, what is necessary and what is a reasonable attempt. So maybe you guys could just speak a little bit about kids and masks.
Sure. Most people who know kids realize that as children become younger, they're more active. If they're wearing a mask, they're more likely to pull it down, pull it up, take it off, put it on. It's just the way it is. Under the age of 2, the recommendation is they don't wear a mask, period. For those, right now for the school boards, the instructions from the province is that grade 4 and up, they are to wear masks. From grade 4 to JK, or sorry, from grade 3 to JK, they're encouraged to wear masks. But as I said, as they get younger, they're less likely to wear that mask. And there's also a risk if they're putting their hands to their face and playing with the mask all the time. One of the ways that you can catch COVID is if you have it on your hands get close to your eyes. It can go into the mucous membranes in the eye. So something on the child's face that has them up with their hands on their face all the time actually becomes a higher risk for that child than if they weren't wearing a mask.
Very good. One topic that's come up a few times is a facial shield. I believe the health unit policy says that a face shield is not a substitute for a facial covering. Perhaps you could discuss when a face shield is either acceptable or maybe reasonable, if it even is.
Okay. As I had mentioned with the risk to eyes, what the face shield does is it protects your eyes. So the mask, if you cough, if you sneeze, if you breathe out the virus, it catches a lot of it. The face shield won't do that, or doesn't do it as well as the mask does. So the mask or the face shield is more a protection to you. If you're wearing a mask, the person near you is wearing a mask, they are protecting you, you are protecting them. Now, that being said, if you are a person who cannot wear a mask, the face shield may give some level of protection. It's not going to be as good as the mask, but it does give you some level of protection, especially if you're doing a sudden expulsion of air, cough, sneeze, this sort of thing. It's going to catch some of it, which is going to protect other people. Like I said, it doesn't work as well as the mask does, but in some circumstances, such as somebody who physically cannot wear the mask, because of medical reasons or whatever, it does give some level of safety. It's better than nothing. All right, but as for studies and that on it, so far it appears that the mask does not give the same level of protection as the mask. Sorry, the shield does not give the same level of protection as the mask does.
Right. So you're a staff member in a business, and someone walks in with a face shield, no mask. The staff might ask, "Are you able to wear a facial covering?" And the customer says, "I've got a medical exemption, but I can wear the shield." And the conversation likely ends there without escalating too much conflict. Does that scenario sound reasonable?
Sounds perfectly reasonable.
Yeah, very good. Okay, I think that example might sort of generate some questions for us by email. We'd certainly be happier to answer or have a conversation about any of those. So I welcome those scenarios, to come back through the chamber, and Vidanik will share some of that info after. But thanks, Burgess, for some of those explanations. I think Vado number 2.
Okay, the other aspect that we've been asked a few questions about is the appropriate customer management for hand sanitizer use. So I guess the question is, like, we've been seeing lots of, hand sanitizer stations coming into businesses, which is great. But I guess to which point can, is it reinforced? Is there a guideline in place for that?
Basically, the hand sanitizers are a good idea. One of the key ways to spread around COVID is on your hands. The hand sanitizer kills off the virus. Now, you should have something for people to use. It's hard to monitor to ensure everybody uses it. I've been in some stores that have, that it's right by a front cash register. As you're going by, somebody mentions that, "Can you please use the hand sanitizer?" Other places just have the station based on the way that their flow works in through the store. There's nobody close to that, and it's working on a self-regulation. The people will use it, will rinse their hands before, or sanitize their hands before coming in. The idea with it is that if you're sanitizing your hand when you're coming in the store, you're less likely to leave the virus on whatever you're touching. It may be missed by some people. If you see somebody who doesn't use it, you can mention it. "Could you please use a hand sanitizer?" If you miss and somebody walks by and you don't know if they've used it or not, realistically, it's there. They can use it. If they don't, there's, again, it's not something that I would suggest running or starting a fight over. Like the confrontational level on this should be low. You ask if the person can use it. That's it. You put a sign up in it, "Please use hand sanitizer before entering the establishment." Most people, when they see that, will use it. Some don't. Some are in a rush to get in so that way they can get in, get out, whatever. But it should be there so people can use it.
Mm-hmm. I think that's about the right balance, Burgess. That's a good way of explaining it, that it sort of builds on the good faith principle again, the be kind principle again. We're not generating extra unnecessary conflict in the store. That just makes it worse for everybody. Certainly, a hand sanitizer is available but not forced. That's sort of the way that I've thought of it. There's a bottle prominently displayed for customer use. Individual products are available for sale somewhere obvious, perhaps. But there possibly might be a reminder from staff to point out for those customers that may have missed it. but you know, we're not necessarily refusing someone, we're not kicking them out of the store because they didn't. So maybe we're providing one verbal cue, and it probably ends after that. I've heard some stories about customers being kicked out of stores and customers and staff arguing over what's mandatory. And certainly we appreciate that each individual business owner operator might have their own beliefs, and of course those beliefs, you know, get passed on to the culture of the staff and the operation of the building. But I think the understanding here is what you said. It's available, perhaps one verbal cue, and then the conversation is likely over. If any of that, if that isn't the right balance, then we certainly welcome your, you know, questions and case examples for further discussion. Sound fair?
Okay, so the third question, I guess, that if you don't mind going over, is we have lots of small and medium-sized businesses in the area, and some of them have little resources at their disposition. So how do you recommend they effectively guide customer traffic in their business location with little resources?
Well, for a lot of the guidance for that, doesn't require a lot of money spent. So if you have two doors, the ability to make one going in, one going out, that works easily. For cash registers, where people check out, I know that the optimal piece is plexiglass to go in front. You have a protective barrier. The person behind the worker behind the glass is separated with a physical barrier. Normally at that point, they don't have to wear a mask or whatever. That may be expensive. I realize the price of plexiglass has gone up drastically over the next couple months. But on the flip side, it's not mandatory. You can work with a cashier using a mask. I'd suggest a set of safety goggles at that point, or safety glasses, something that wraps to the side of the eyes as well, and just deal with the people like that. That is an acceptable solution. It protects your staff. The person at the other side are being protected. The one place that it becomes a little less safe, if you want to put it that way, is if the customer is not wearing a mask. But at which point you can work with asking the person to stay back from the counter. You check in his stuff. When the person walks up to pay, let's say puts cash down on the counter or goes to use the Visa machine, you back up from the counter, so you're keeping the 6 feet. When they back away, and just work sort of a seesaw back and forth like that. You know, that's a relatively inexpensive way to keep the physical distancing you need for your safety without having to spend a bunch of money. Other areas, cleaning and disinfecting, things like the countertops and that is not really an expensive item. A bottle of Clorox spray, a pack of Lysol wipes, and please note these are not setting up these particular products as the gold standard. They're just easy to remember names. But something like that for the cleaning is easy. tape on the floor as opposed to the purchased stickers, you know, showing the 6-foot distances as people line up. Taking a look, I've been in places that use or that request a limited number of people in the establishment at any one time. They take a look and they say, okay, realistically, you know, I can operate with 6 people in here. Was it small, or 10 people? Because they're not going to be, you know, within 2 feet of each other. They'll be able to keep 6 feet. You have a sign on the door saying, you know, please respect, you know, 6 people in the place for your safety and theirs. You know, and that's judged based on floor space and the amount of items in it. I know whenever this started, we had a couple business asking us, you know, they have X number of square foot, and they say, so we're looking at 2 meters, so 4 meters per person, therefore this should be the figure. But you've also got to include stands and shelves and everything else whenever you start taking a look. So you're probably better to eyeball it and get an idea of what you're dealing with if it's small enough where you feel you have to restrict the number of people in there. But for the most part, a lot of this can be done very cheaply. It doesn't take really expensive items to do it.
Very good. I think the idea when we think about physical distancing is, like you said, there isn't necessarily a formula. You know, you're sort of, you know, you're working on the principle of trying to maintain a 2-meter distance whenever possible. Certainly that distance, you know, might be encroached upon, you know, for seconds at a time. That's all reasonable. You know, a renovation isn't required. You know, putting up walls and permanent things are certainly not required. Using some signage, some available through the chamber, others on the public health website. Using tape on the floor. I've seen dots in some grocery stores and hardware stores. Trying to open up a second door so that there's an in and an out area. Limiting the number of customers in the store can be a very difficult thing to do, especially with depending on the layout of the store. I would say that a sign in the door would probably act like a passive sort of way of controlling. Naturally, many people will be respectful coming in and sort of peek in, take a look at what's going on, and if it seems like there's lots of people walking through the store, then they might wait. I think the advice to the business operator is think about, you know, how we can interact with our customer, but reduce the amount of time and touch points, physical touch points, while they're inside. So is there an option for curbside delivery? Is there an option for home delivery in some professions? Can we do certain things by phone to minimize the time spent in store? Can we do things on social media? Can we get some information out to teach the public what we've had to do for our establishment specifically to make sure that it's safe and that we are you know, minimizing the footprint, so to speak, in the store. So the arrows, the call ahead, the curbside, all those types of things. I think the question here is that some of these things may be longer lasting than others, and which certainly the requirement is not a full renovation, not you know, something that necessarily needs to be very permanent. So the resources, the lesser resources that small to medium enterprises have, this should not necessarily be a barrier. It's a challenge. We're certain that this is going to take some work, some coaching, and some collaboration. But certainly, for the most part, it shouldn't require large investments financially. And for those that are having you know, a specific challenge, we certainly we certainly invite those questions through the chamber as well. Very good, very good. Maybe Vitanek, I'll sort of explain the next one. It's something that I think is maybe more scientific than some of the others, but some questions that I've had personally are, what do we do? So the topic is caring for staff. What do we do with non-specific symptoms? So if the cardinal symptoms of coronavirus are, fever, cough, shortness of breath, or trouble breathing, then what do we do with all the ones that have come up around it in the press? So coming into flu season specifically, and with kids going back to school, what do we do with the runny nose, the headache, the pink eye, and the other sort of fringe ones, if we want to call them, like a sore toe, I've heard, and some of those other ones that are not the sort of initial or more core symptoms of fever, cough, shortness of breath. So what would public health like to elaborate on in terms of non-specific symptoms for our staff?
Okay. Unfortunately, this is a rather difficult question to answer, because if you have a non-specific symptom, you've got a headache, and for you a headache is not unusual, then that wouldn't be considered really a symptom of COVID. However, if you are a person who rarely ever gets headaches, and there's no particular reason, like you were out the night before, to have a headache at this time, then it might be a symptom. Now, I realize it sounds like I'm talking out of both sides of my face whenever I say that, but the problem is that for many of the less obvious or symptoms, they really are based on what else is happening around it. So let's say you had a headache and a runny nose and some pink eye. At that point, you should probably get tested for COVID. However, it is the fall, and every fall with a specific plant pollinating and going to seed, because this is when it flowers, you always have a runny nose. And this is not an issue because this is normal for you. So you have to take a look at what is normal versus what is not normal for you, and then start dealing with it this way. Something like pink eye, you want to see your doctor anyway, because you can't treat pink eye yourself. You need an antibiotic for it. So you want to see your doctor for those sorts of items anyways. You should, if you're dealing with a number of these symptoms, get a hold of a health professional, ask for their advice. You can give the health unit a call, but we can't prescribe and we can't diagnose. All right? But you want to make sure that you're running through. So if you have a person who gives you a call and says, hi, I've got this splitting headache, they're noteworthy for migraines, perfect. When it's done, come on back to work. Mm-hmm. The person says, I've got this splitting headache, I never get headaches. You may want to go and speak to a health professional to see about whether you should get COVID testing or not. So you've got to take it in context of the person you're dealing with. And for a number of the the symptoms, they are very generic. So you really have to look at them in terms of the person who you're dealing with. Is there a reason that they may not be running like this. The other thing that we look at is this a worsening situation? So I have a normal cough. So for me to sit there, I come into the office and I cough, nobody even blinks anymore. If I have a worsening cough, this is now an issue. So the cough itself is not an issue, but a worsening cough is an issue. You have a person who has a sinus congestion issue on a regular basis, so they'll have a dripping nose. That's nothing to be concerned of. It's on a normal basis. The worsening of that becomes more of an issue. So you've really got to take a look at what is happening with it. Now, if the person does go and get tested, they've talked to a medical professional, the person has said, yes, you should go get tested. They booked their appointment to get tested, they've gone and get tested, they come back negative. Then our advice is, depending on the symptoms, is 24 hours after symptoms are finished, they can go back to work, they can go back to school. And that is because although you don't have, it may not be COVID, we don't want you to spread the flu. We don't want you to spread something else. If it's GI symptoms, vomiting, diarrhea, because those are some of the non-normal associated symptoms for COVID, we suggest 48 hours after symptoms stop. And that's because for something like Norwalk, which is very prevalent through the fall and winter, also very contagious, you're basically still able to spread Norwalk for 48 hours after symptoms stop. So the suggestion for waiting after you get a negative result is just not to spread something that you have that may be a risk for somebody else as well.
Very good. So we think of it like, first, of course, they can be using their healthcare provider for this kind of screening. So in the pharmacy, we field calls like this every day. But the overarching questions are: do you normally feel like this, or does this time of year normally have you with a running nose, a headache, whatever it is? And then 2, has it gotten worse recently? What is its trend? And then if it's getting worse and you don't normally feel this way, then perhaps you should be tested. And if you're going for a test, then you shouldn't be at work or school until a negative test comes in, correct?
Yes, if there is suspicion you have COVID and you're going for a test, you should be self-isolating.
Very good.
Until the results if the results come back positive, you will be getting a call from the health unit. We will be doing contact tracing. We will be getting a hold of your close contacts and instructing them on next steps. Gotcha.
The lag time on average, perhaps for this area that we're in, being this far COVID, is it 24? Is it 48 hours? Is it more?
Right now, the numbers we've been seeing is basically 24 to 72 hours to get results back. Most of them are coming back in 24 hours, but as with anything else, there are outliers.
Sure.
If things get really busy, a lot of people coming in, then the testing may take longer, or to get the results back may take longer. But right now we're working with 24 hours as an average, up to about 72 on the outside.
Okay. Reintegration into, work or school. So if they had a negative test, they can essentially return when they're feeling better. If they had a positive test, it sounds like a 14-day self-isolation and return when they're feeling better?
You would have a 14-day isolation. But like I said, the nurses will be, whenever they call you, will be going through that.
Sure.
Right now, it's to my understanding, it's 14 days isolation, and you're also going to be looking at your contacts and everything else. So, and obviously, 24 hours after symptoms stop, the symptoms continue.
Okay. I think the last piece that I wouldn't mind us elaborating on is just, employee screening. I think the guidelines said that we should have a policy on that, and there's a variety of ways to do this. Some bigger businesses are, have an employee at the entrance and they're asking them a questionnaire every day before their shift. And other small businesses are probably operating on a self-report type of basis. So, our policy is just that if you feel this way, then you let us know. Can you maybe speak to what a screening program might look like for a small business?
There's two options. You can either do an active screening, wherein, as you said, you ask the person when they come in, please go through the screening list, please sign here. That is one option. For a lot of places, what they're using is the screening tool on the Ontario government website. So they just ask people to go through it before work, before they come in. They go through the thing, they come in to run through the screening, yes, any issues, no. Again, you're working on an honesty principle. You're assuming the person is being honest on what they're telling you. In either case, the idea is to catch somebody who's starting to not feel well, who's starting to potentially coming down with COVID, potentially being able to spread. Now, most screening tools also cover international travel to ensure that the person is not supposed to be self-isolating at this time. But if the person hasn't been out of the country, really what they're trying to catch is, are you not starting to not feel well, so we can catch this early before you're more likely to spread.
Very good. So obviously there's going to be a spectrum of screening policies depending on how robust the staff. The bigger the staff, potentially the more systematic this might become. But I would say it could be base it on your own discretion, the size of your business, the size of your staff, and the general concept is to catch something faster by having some kind of reminder system, regardless of whether it be a screening tool or a verbal tool or thing that says, you'll let us know if you feel this way, that the owner or the operator should have something in place to catch something early enough that sets us up for success.
Yeah, that'd be correct.
Okay, excellent. I think last one.
The last item would be if there are any markers established to determine, becoming a bit more lenient, I guess, with the measures put in place in Ontario to stop the spread of COVID.
Specifically, I don't know the markers that are being used by the provincial government. There is the Reopening Ontario document that the government put out, giving the different phases or stages of reopening. However, really from my perspective, I would think what's a more important question on when can we reopen more is how do we avoid going back? If you take a look right now, some of the provinces in Australia have had to go back to shutting everything down. France is dealing with a second wave where they're starting to have to tighten things up again. This is happening throughout the world where things opened and then shut back down. So really the use of masks, the use of hand washing, it may be a little intrusive, you know, for a lot of people that they're not happy wearing the masks. I can understand that completely. But the idea is everything we can do to lessen the expected second wave means that it's less likely we'll have to move back to have to tighten things up. So although I really couldn't tell you the exact numbers or exactly what the trigger would be to go to the next step to open things up even wider, I think what really people should be looking at is how do we keep from sliding back where we have to start restricting things more, where we have to start closing down the businesses again.
Mm-hmm.
All right, so I realize that doesn't exactly answer your question, but it is really something that should be considered, because if things start to go south, that may be on the table again.
Yeah, I think the questions from some owners are, and perhaps some of these sort of, I'll call it polite frustration or empathetic frustration, you know, comes in those businesses that have had less opportunity to run the business that they normally would through this period. Or, you know, they're saying, you know, we're hearing we've flattened the curve, we've reduced the stress on the healthcare system. We certainly are seeing a reduced number of cases trending downward. What is the number, or what are the science markers? What are the measures that we can change the discussion with? So perhaps we don't have those, and I think we wanted to ask that question anyway. Certainly we understand the idea of prevention as our primary objective, but I think we just wanted to probe a little bit about, if there was a discussion, are we ready to hear what the next triggers are for sort of peeling back facial coverings and all, and maybe social distancing and some of the other components to the policy?
Well, I don't have specific numbers and I don't have specific items for you, but realistically, COVID is still out there. And until we can honestly say that you're not looking at spread, you know, Sudbury alone had 2 weeks where we had 20 plus cases. And that was after we had no cases for 5 weeks. You know, we just had a huge spike. So it's really difficult to say, well, just because we're not seeing any cases, that COVID is no longer here. So I think you're going to be looking at something that's going to have to be looked at or considered province-wide or country-wide. And there will be a number of different items that are going to be in that mix on how they choose that this is done. You know, something like a vaccine coming out and available would be something that would be taken under consideration. But something else that would have to be taken under consideration is how much of the population has received it with the number of doses they need to receive. You know, there are a whole bunch of variables. I really couldn't give you a full answer, or even one that I would consider accurate if I was saying that, you know, this is what is required. I really couldn't at this time.
Very good. I think we appreciate that honesty. There certainly are mixed feelings on many of these topics, and we're empathetic to the various opinions on it and how it affects everyone in their work life and their home life. I think some people are certainly interested in hearing what the next steps might be, and others are less ready to hear some of those things. So certainly the vaccine makes a lot of sense that might be a open the door to a new discussion. So I think we await that. I think we owed our members that question anyway, and I appreciate that while you weren't able to have a full concrete answer, that we understand how complex that is, but we thought we would ask anyway. I think that's about it. We're pretty tight on time. Vida, Nick, anything to add? If not, maybe I'll just sort of close it up.
No, just thank you so much for your time. Jason, Burgess, Adam, it's really appreciated. And I think this is going to give some much needed clarification to our local businesses.
Well, hopefully we could be some help. If people have questions, like you say, they can run them through you. Anything that you want to send to us, we'll be happy to take a look at for you. Or they can give us a call direct.
Very good. Thanks, Burgess. Thanks, Adam. Maybe Vida, you can tell us where they can reach out to us. Of course, we're always open to hearing what's going on in your business, how COVID has affected things positively and negatively. I think as a overall summary of some of the key points, as a business operator, as you're navigating the gray, we're trying to protect ourselves and the community at the same time. We're not trying to introduce extra unneeded conflict. So we're acting on good faith where we have to. We're being reasonable where we have to. And there certainly is a wide array of measures that might be relevant to you based on the size of your business, company, that type of thing. And the Chamber is here for you to help you navigate. So, Vida Nick can sort of tell us, what we have out there for you to reach out, and we welcome those conversations by email or phone anytime.
Yeah, so anybody, all these, this recording will be available to all of our members through an e-blast we'll be sending out. We're present on almost every social media platform, Facebook, Instagram, LinkedIn. We have a YouTube account as well. So simply search for Sudbury's Chamber of Commerce. And you can send us a message anytime through those platforms or directly to me at bdo@sudburyschamber.ca. I will be posting all the contact information along with this video. Feel free to reach out anytime. We're here for all our local businesses and members.